Hi, I'm Lisa Leiter. In Chicago Business Today, hospitals and healthcare reform. Hospitals are in a tough spot when it comes to healthcare reform, making changes that could ultimately benefit them, like running fewer expensive tests, will cut into revenue now. But if they don't do it, they could be hurt in the long run because of the way the payment system will change. Chicago area hospitals may be more affected by the changes than other areas, and I sat down with Crain senior reporter Mike Elias to talk about his story in this week's Crains. So Mike, you write this week about how healthcare reform is going to change the way hospitals are paid. Can you talk a little bit about what the changes will be?
Yeah, and those changes will come eventually, which is part of the problem. They don't come right away, so it leaves hospitals kind of figuring out what to do. But today it's a fee-for-service system by and large, so that means that every test or procedure or office visit comes with a payment attached to it. And what health reform's trying to do is gradually steer the system toward paying for quality and efficiency, and taking that financial incentive of higher volumes out of the picture.
So what are some local hospitals doing to respond to this and anticipate these changes?
We talked to Advocate Healthcare, is the biggest hospital system in Chicago, and they're taking some steps that you would very much expect people to take under this bundled payment system, where a baby delivery, for example, every doctor involved would get a payment and the hospital would get a payment for every little test and procedure within that. In the future, it'll be, $12,000. You figure out how to divvy it up among all those clinicians in the hospital. So Advocate's doing things like trying to reduce the number of lab tests that their physicians order, and like imaging, like CT scans and MRIs, which are very expensive, cutting back on avoidable hospitalizations. So all the things that would help them under this sort of bundled payment structure. But the trick is that today it doesn't help them. It actually takes revenue away from them. And so I think they've made the calculated decision that they'll forego some revenue up front to be better positioned to take advantage of that sort of bundled payment structure in the future.
What is Advocate telling you then for this transition period? It could be a little bit bumpy, right?
Yeah, I mean, it'll be a few years. So the Medicare system, which is the one that's sort of tinkering with all these ideas, I mean, that's really what they're doing. They're running pilots that probably won't start for another year or two. And they'll figure out in different markets, are these payment reforms, do they make sense, are they working? In the meantime, a system like Advocate, I think you just kind of have to take a leap of faith that eventually the Medicare system and or private insurers are going to move more to this system where, if you're taking better care of patients sort of across the whole spectrum of care from the time they get a test to the time they go to rehab, you're going to be rewarded for that. And large systems like Advocate, like North Shore University Healthcare, like some of the academic hospitals in town, they're better positioned because they have that sort of wide spectrum of care to be able to track those patients from beginning to end.
And why are Chicago area hospitals probably going to be more affected by these changes than other major areas?
Well, Chicago hospitals aren't as efficient as hospitals in other places, at least that's what statistics show. I mean, they spend 25% more on treating a Medicare patient than other markets in the country do. And so they also have a much higher, one of the worst in terms of readmission rate. So really sick people who leave the hospital and then come back shortly thereafter. So those are indications that under a system in which your little sources of revenue quickly, like overnight, become costs because the payment reforms, they could struggle under that scenario.
And also the idea that doctors in this area don't tend to work for the hospitals. They're in private practice, right? So you might be getting a test done at your doctor's office visit, and then a month later the same test is being conducted at your hospital.
That's right.
Visit,
yeah,
right?
It's a splintered sort of market, both among hospitals and physicians. And physicians don't have to be employed to sort of integrate that care better, but you've got to have software systems that link doctors and hospitals, and you've got to sort of be on the same page in terms of clinical protocols. And that doesn't happen in Chicago as much as it does in some other places.
So what about the insurance companies? What kind of role are they going to play in all this?
Well, I mean, normally the insurers would sort of, they follow what Medicare does, but just in a couple conversations I've had, I mean, it sounds like some of them might see this as an opportunity and actually beat the federal government to the punch on this. I mean, these payment reforms like Blue Cross and Blue Shield of Illinois, which is by far the biggest in this market, says that they like this idea of bundled payments. They've had experience with it in the past, and it's shown to reduce costs. And they, as early as next year, expect to have some contracts with hospitals that would use that bundled payment structure. And that's an indication that local hospitals really need to sort of pay attention to this trend, because if Blue Cross is doing it here, that's big for the market.
Absolutely, Mike. Well, good story this week, and we look forward to hearing more about this in the future.
Thanks, Lisa.
And that's this edition of Chicago Business Today. To read Mike's story, check out this week's print edition or chicagobusiness.com. Thanks for watching. We'll see you tomorrow.